So it would be not 4.5, 5, but 5.5. So we've gone from a 3 up to a 5.5, which would give us a total of 4 millimeters of expansion. And that's the average that we get if we start at the right time. If you don't start at the right time, then you don't get the advantage of the centrals coming in or the laterals. Now, a research project that was done many years ago in St. Louis, Missouri, showed that the majority of malocclusions form around 6 to 8 years of age. Also, if we look at crowding of the incisors, almost all of the incisal crowding starts by 6 and finishes by 8, and the rest of the time into adulthood, very little crowding occurs. So if we could prevent this from occurring, we could hold this dentition down here and eliminate all this crowding that would be coming long term. Also, the overbite increases about 2 millimeters between about 6 and 10 years of age. And so we'd like to prevent that from developing because the overbite is so hard to correct orthodontically. We had an experiment done in Finland. Finland is a socialized country, so it's very easy to go into a little town and call every child in the town in to have an experiment done. And so we took 4 towns in Finland, and we had 167 children in the night guide technique and 104 in the control group. And this was done out of Turku University in Finland. In the beginning, there was no difference between the crowding, between the control and the treated sample, and there was no difference in the mandibular crowding. But at the end of the treatment period, there was a tremendous difference between the 2 samples. In other words, the treated sample corrected the children down almost to a 0 amount of crowding. We saw the same thing in overbite and overjet, except we don't want to correct overbite and overjet less than 2 millimeters because we anticipate further growth after 8 years of age. We also increased the mandibular growth by almost twice as much as they got in the control sample. So this helps in controlling the overjet and also intercuspation. And for example, class 2 molar relation, we can correct that with advancing the mandible very easily without moving teeth. So we get about 4 millimeters of an average. If the case is started at the right time, we get 4 millimeters in the lower and 5 in the upper. Well, about 95 to 96% of all crowding in the United States is less than 4 millimeters. So we could prevent probably close to 95% of all crowding by doing this.